Moving on to the back, the posterior part of the torso, upper trapezius, middle trapezius, and lower trapezius. Upper trapezius, middle trapezius, lower trapezius. All three of them will do a deduction of the scapula. Upper trapezius will do elevation of the scapula, and it will also do lateral flexion of the cervical vertebrae. The middle trapezius, a deduction. The lower trapezius, a deduction. And then it will do some rotation, some lateral rotation of the scapula, and it will also do some depression of the scapula. Retraction and depression, so it does quite a lot. For most of us, this is non-existent because we don't do the work that's associated with that kind of movement. Upper trapezius, middle trapezius, and lower trapezius. When the trapezius muscles are being cut away, splenius capitis, levator scapula, rhomboids. So rhomboids is a minor and a major. Levator scapula elevates the scapula. It will do some rotation towards the same side of the head, so the chin will come to the same side, and will also do some extension. Rhomboids will do a deduction, so they'll bring the scapula closer towards the vertebral column, and because of the direction they will also do some elevation. They will lift the scapula up as well. Is the scapula. There is the spine of the scapula, the medial border of the scapula. Above the spine of the scapula is supraspinatus, superior, above the spine of the scapula. It initiates abduction at the glenohumeral joint, so abduction of the arm. It will lift the arm out to the side. Below the spine of the scapula is infraspinatus. Infraspinatus will do lateral rotation at the glenohumeral joint. A small muscle just underneath infraspinatus is teres minor. Teres minor also will assist to do lateral rotation at the glenohumeral joint. This muscle is teres major. Some people will include that in the rotator cuff muscles, other people will not include that. Teres major goes around to the front of the humerus, the anterior part of the humerus, close to the bicipital groove. Supraspinatus, infraspinatus, teres minor, teres major, and underneath the scapula is subscapularis, and subscapularis is the major medial rotator at the glenohumeral joint. Rotator cuff muscles for some people, supraspinatus, infraspinatus, teres minor, and subscapularis. For others, supraspinatus, infraspinatus, teres minor, and teres major, and subscapularis. This big muscle here is latissimus dorsi, so it comes from mainly T6, goes all the way down via the aponeurosis, follows the ilium, attaches to the ribs, goes underneath, comes to the front of the humerus, to the bicipital groove. So it will do extension, bring the arm backwards. It will do a deduction, bring the arm in towards the side. It will also do medial rotation as well. Extension, a deduction, and medial rotation. Latissimus dorsi. A group of muscles that comes from just behind the ear onto the occipital bone, and then comes all the way down, very close to the vertebral column, and all the way down via the aponeurosis The strap of muscles collectively is called the erectospinae muscles. Erectospinae muscles, the back strap muscles, different names that are given to the same group of muscles. So they come from behind the ear and they collectively come all the way down, attaching to ribs, to the vertebral column, and all the way down. They will lift the head backwards, extension. They will also lift the torso, as in lying face down and lifting the head and the chest off the floor, off the table. So they will do extension. They will also partake in lateral flexion of the vertebral column, the erectospinae muscles. On the posterior part of the hip region, gluteus medius, gluteus maximus. So medius indicates there's a middle-sized muscle, maximus says there's a big one. So gluteus maximus will do extension at the hip, and if you have a look at the direction of the fibers, it will also do lateral rotation at the hip as well. And this also comes into the iliotibial band, the iliotibial tract. Gluteus medius, gluteus maximus. When gluteus maximus has been cut away, as in this diagram here, medius, the superficial muscle, underneath that is minimus, so there's a small one as well. And then just a little bit inferior to that is a muscle called piriformis, pair, form, shape. That can be really significant for sciatic problems because on occasions either one or both branches of the sciatic means hip, the sciatic nerve pass straight through the middle of this muscle. So if that muscle is tight and entrapping the nerve, sciatic pain will come down the leg. So the hip region, gluteus medius, is the superficial muscle on the lateral side. Underneath that is gluteus minimus. Gluteus minimus will do abduction. Piriformis primarily will do lateral rotation at the hip. This is onto the ischium. The ischium is where we sit on, the sit bone. And these are the muscles of the hamstring group of muscles. And they all come in and around this region just here. All three of them. We've got biceps femoris, biceps femoris, semitendinosus and semimembranosus. So they are the hamstring muscles. And they all come into this region, the ischial tuberosity. These are the hamstring muscles complete. Biceps femoris, biceps femoris. So bi, it's got two heads. Biceps femoris, a long head and a short head, and it comes down to the proximal head of the fibula. Semitendinosus, T tendinosus sits on top of semimembranosus. So semimembranosus is underneath, it's deeper than. So the lateral one is biceps femoris, biceps femoris. Semitendinosus is on the medial side, and underneath semitendinosus is semimembranosus. Coming over to the other side, where biceps femoris and semitendinosus are being cut away, this is semimembranosus. As a group, they will do flexion at the knee, so they'll bring the heel towards the back side. They will also do extension at the hip as well, but primarily flexion at the knee. Biceps femoris on the lateral side because it comes to the proximal head of the fibula. On the medial side, semitendinosus. Deeper than semitendinosus is semimembranosus. It will also be worthwhile pointing out that from a posterior view we can still see gracilis as well. And then further in we can see the adductus, adductor magnus. Onto the calf area we have gastrocnemius, the lateral head and the medial head of gastrocnemius. They come from the femur, they go onto the Achilles tendon, and they go onto calcaneus. They do not attach to the bones underneath there. They come from the femur to the Achilles tendon and then onto the calcaneus. They will do plantar flexion, so they will go up onto the toes, particularly when the legs are straight, extended. And underneath that is soleus. So on this side, gastrocnemius has been cut away, and there is soleus. Both these muscles will do plantar flexion. Gastrocnemius works best when the legs are straight. Soleus works best when the knee is bent. Gastrocnemius, plantar flexion, and because it then attaches to the femur, will also assist to do flexion at the knee. Soleus, plantar flexion. Gastrocnemius goes directly into the Achilles tendon. Soleus attaches to the Achilles tendon much lower down onto the anterior surface. Gastrocnemius, soleus.